This question may not make sense, but from what I understand, simple mind, you said the knees are more painful for people than the hip. So are you less likely to do a bilateral, offer a bilateral knee surgery because of that? No.
Yeah, but maybe you can speak to that because I think it's very clear from experience and also just from how patients do. People always think hip replacements are going to hurt more than knee replacements. They think that.
Yeah, that's not true.
But knees are I always tell people just prepare yourself.
Really?
Yeah, we haven't been able to. There's no medicine or no technique that has made post knee replacement surgery fun. You know what I mean? It's not an easy time. Hip replacements. I don't know. Maybe you can speak to that and on what some of the differences you see between people undergoing like an anterior approach hip replacement and a total knee replacement.
Oh yeah, total knee replacement unilateral is bad enough. And if you've ever watched a replacement surgery, you would know why. So I kind of laugh sometimes when patients say like 2 weeks later, like, "Oh, I don't know why, but my knee is still sore." I'm like, I said, have you watched the video?
Yeah.
You know. So, and then bilateral knee replacement generally is like not twice as sore, it's probably 4 times as sore.
Really?
I don't have twins, but I usually will actually tell patients it's probably similar to having one child versus having twins. It's probably not twice as bad. It's probably like 4 times as bad in terms of energy expenditure, right? So on the parents, I mean, right? So taking care of the kids. But bilateral hips, people tend to do really well. They kind of waddle around when they first come in. But pain level wise is generally not even close to bilateral knee replacement.
Wow.
Yeah.
And you guys haven't figured out a reason why that might
I
be?
think like some joints tend to be just more painful, like shoulders. Like Ed Weldon, our and the other shoulder surgeons tell me that shoulder surgeries are painful.
Wow.
You're right. Yeah.
Shoulder and I would say maybe even elbow too. Yeah.
We have I've seen a small sample of individuals who've had knee replacement, hip replacement, anterior hip replacement, right? And either a rotator cuff repair or a labral repair in the shoulder. And they said that the shoulder surgery is the worst.
Really?
Oh, yeah.
Shoulder.
Yep.
Is it just so much nerves, maybe? Nerve
Yeah,
endings
that's what
and
I think. I think there's probably just, again, simple mind, right? Just to explain to people. I'm like, if you walk and you bump your okole on the coffee table,
Yeah, not so bad.
It doesn't hurt that much, right? You're like,
I get plenty padding.
But you hit your knee on the coffee table. Oh,
Sore.
that sucker is sore, right? Because there's really no...
Or your funny bone, right?
Yeah, there's no cushion around your knee. There's just skin
Yeah.
and bone, right?
Yeah.
So you
hurts.
fall on your knee. Oh, God,
That's true.
That hurts, right?
Yeah.
And I would just imagine shoulders and upper extremity, the innervation patterns are just,
It's the
because
nerve.
we have to be more dexterous. You have to know, I mean, you can't have a dumb shoulder, otherwise you're not going to know where your hand is in
Yeah.
space, right? So I that's my simple explanation for why just some joints are more innervated or, or just evolutionarily meant to be more protected, right? So
But you know what's interesting about pain after surgery is that the younger individuals seem to have more pain. Right?
100%.
Really?
Yeah.
Yeah.
Or is it going back to what you were saying where people lived with it for so long?
No, I think I think there's this is my my opinion about it is that I think it's 2 reasons, right?